Hi everyone, in this video we're going to start talking about serotonin receptors. Now there are like 14 serotonin receptors, so there's a lot of them, the most we've seen yet. They're identified into like 7 different families. So you will need to know like what about each family. Okay, so like know that family serotonin 1 is a G-coupled receptor that inhibits. Okay, so it decreases CAMP and GERK. And then you'll need to know that serotonin 2 family is also G-coupled, but it's Q, so it modulates. So it modulates PLC and increases calcium. Serotonin 3 is probably going to be the easiest to remember because it's the only one that's ligand gated. Okay, so it's the only ligand gated channel for both sodium and potassium. So 3 is ligand gated. 1, 2, 4, 5, 6, 7 are all G coupled. Serotonin receptors 4, 6, and 7 are all G-coupled that stimulate, so they all increase CAMP, so you can kind of group these 3 together. And then serotonin 5 is G-coupled inhibitory, so serotonin 5 does the exact same thing as serotonin 1. Okay, so there's 7 families, but you can kind of group them together into like 4 categories. Okay. Now, some of you might ask if this is right, because serotonin 1 G-coupled receptors, they can be broken down into serotonin 1A, 1B, 1D, 1E, 1F. You might be saying, Aaron, you forgot how the alphabet works. There should be a C. Turns out there used to be a serotonin 1C, and then we realized that it was wrong, and that so serotonin 1C became serotonin 2C. Okay, so there is no 1C, but there is a 2C. Confusing, but you know, turns out that science is wrong sometimes, so we gotta fix it. So, yes, you'll need to know all of these receptors. We are going to go through and talk about them kind of more individually, so it should help. So first we'll talk about serotonin 1A. So this one is one of the bigger receptors. You'll hear about this one a bit more if you start reading papers about serotonin. So serotonin 1A receptor functions as an autoreceptor on the somatodendritic, so on the dendrite, so it's on the dendrite to the soma as an autoreceptor rather than being on the postsynaptic cell. It's on the presynaptic cell. Now we've got some agonists for serotonin 1A. The one you guys probably know most or heard most about would be CBD. So CBD is a partial agonist for the serotonin 1A receptor. How fun, right guys? Now remember that 1A, if we go back to our list here, 1A, so it is a G-coupled protein that inhibits downstream, so it's going to decrease CAMP, decrease GERK. So that means our agonist CBD is also going to decrease CAMP and decrease GERK. Okay. Also, our partial agonist that's used as an antidepressant, anxiolytic would be buspirone. So this is one that would actually be prescribed more, or used to be more. I think CBD is prescribed more now. But our typical kind of drug would be buspirone that acts as an agonist. So both of these will increase the inhibition downstream of CAMP and GERK. Okay, so the agonists cause hyperphagia. So both of these will cause hyperphagia, and that's because agonists will decrease serotonin release. Why? Because they act on an autoreceptor. So remember, autoreceptors modulate the amount of serotonin released. So if we increase an autoreceptor, we will end up decreasing serotonin released into the synapse. So what this does is it can prevent attenuation of appetite. Okay, so a lot of times then we'll see serotonin 1A receptor concentrated in the hippocampus, the amygdala, and the septum. There are some, this is an inhibitory neurotransmitter, again because it's a GI, so that's where it works on. Signals through G beta Y to specialized inhibitory potassium channels. So GERK is the G protein coupled inward rectifying calcium channel. Okay, that's what GERK stands for. G protein inward rectifying potassium. That's GERK, if you didn't know. You should know CAMP if you don't review what you've learned in previous classes about CAMP. So that's serotonin 1A. It functions as an autoreceptor, which will, if you increase activation of serotonin 1A receptor, you decrease serotonin release. Boom, know the agonists. Okay, now, if we kind of think back to the last video where I talked about some of the serotonergic systems, we talked about how there's a lot of effects of serotonin in the body, and so there's actually been some studies that look at the serotonin 1A receptor and how it's involved in one of those effects of spirituality. So pretty much then there's a numbered compound developed by this dude scientist. He kind of named it after himself, so it's Way 1635. It's an experimental selective serotonin 1A receptor agonist. So we know that means it'll decrease serotonin release. It's used as a PET ligand to identify the receptors of serotonin in the human brain. So we use this compound to identify these receptors. So it's like a way of using it as like an antibody type thing. So when we learned about immunohistochemistry, then this is the ligand we would use to attach to the receptors, right? So what this group did is using this compound, then they looked at the amount of serotonin 1A receptors in the human brain, and what they found was a correlation in the binding capacity of serotonin 1A receptors with the components of the temperament and character inventory self-report questionnaire in males. So what they found was that there was a significant correlation with the amount of serotonin 1A receptors in the brain with spiritual acceptance in these males. So they concluded that their serotonin, the system, plays a role in how spiritual someone is. So they called it spiritual zeal, which I think is just fun. And they actually looked at not just the receptors, but how the proteins within the receptors were folded. And they saw that based on how the receptor was folded in different people, there was a correlation between how it was folded and their scoring of their spiritualness. So it suggested that maybe how your serotonin 1A receptors folded can lead, or is one of the things that leads to how spiritual you are. So kind of cool. We're tying together our receptors and our systems. Woohoo, guys. Okay, let's move on to different receptors. What? So we're still talking about serotonin 1 receptors. So these are still going to be inhibitory. So this is serotonin 1B and 1D. You can kind of group them together. And again, they're serotonin 1, so they're going to inhibit through CAMP and GERK. Okay, they're going to decrease the amount of CAMP and GERK downstream from the G-coupled protein. So serotonin 1B is not expressed in humans. So this is where we see animal research comes in. A lot of receptors are found first in animals and then in humans. So that's why we've got serotonin 1B. Instead, there are 2 variants of serotonin 1D in humans. So we call it 1D alpha and 1D beta. Okay? So we still end up with the same number of types of receptors in humans. They're just named slightly differently. But these receptors are found on intracranial blood vessels. And so agonists of these receptors include anti-migraine medications. So one of these would be sumatriptan. So it agonizes 1B and 1D receptors, thereby inhibiting CAMP and GERK downstream. So how that works. Now, this is kind of just a nice intro to migraines, and then we can see how serotonin plays a role in these migraines. So cortical spreading depression. So pretty much a lot of times migraines will start back in the occipital lobe, and then we have cortical spreading. So like this GIF shows. I don't have enough GIFs in my slides, guys. And so because we've got the starting point in the occipital lobe, that's why sometimes patients will get what we call auras. So if you want to know more about auras, you can look those up. But they're usually like a signal that something's happening, kind of a precursor. So this expanding pulse of activity is followed by hypoactivity, so decreased activity. So that's that spreading depression, that spreading hypoactivity after the first impulse. Okay. Now migraines are also accompanied by constrictions in blood flow. So you can see why constrictions in blood flow is going to relate to our serotonin receptors that are on those blood vessels. What? So reactive vasodilation causes pain. Now, you don't have pain fibers in the brain, but your dura mater and meningeal blood vessels are innervated by pain fibers. Okay, so the meninges, remember that's like the protective layer on top of the brain. So that's actually where the pain is coming from, is your meninges, not the brain itself. So the sensory fibers will release vasodilating peptides, and these peptides promote a sterile inflammatory response. So inflammation will cause sensitization of the sensory fibers, and that's why people with migraines or even headaches will be sensitive to light and sound. And that's because of the inflammatory response to the migraine. So how does serotonin help modulate the pain of migraines and stuff? So serotonin actually helps to modulate the release of these neuropeptides that leads to the vasodilation. Okay? So without the vasodilation, then we won't have the pain in the meninges, and then we won't get the sensitivity. So that's where our serotonin 1D receptors come in. And so these receptors are inhibitory, remember? So if we activate our serotonin 1D receptors, what it does is it actually prevents the vasodilation. So instead we get vasoconstriction. So with that, then we no longer get the pain in the meninges, and then we don't get the sensitivity to our senses. So an agonist of the serotonin 1D receptor, so medication for migraines would be an agonist for this receptor, would inhibit the release of our vasodilating peptides. So this promotes that vasoconstriction. It'll lead to decreased excitation of the tegmental nerve and decreases the effects on the nausea centers as well. So it doesn't just go to the blood vessels and stops the vasodilation, but it also sends information to the gut so that it turns off that nauseous feeling that can also accompany migraines. So that's serotonin receptors 1A and then 1B and 1D. In the next few slides, we'll start talking about different family of receptors. We'll move on to serotonin 2 receptors and so on and so forth.